The impact of drug shortages on children with cancer. The example of Mechlorethamine. Cancer treatment. Chemotherapy, radiotherapy, immunotherapy, surgery. What are anti-cancer drugs? The anti-cancer drugs either kill cancer cells or modify their growth. Discovery of anti-cancer agents started after 1940s, when nitrogen mustard was used. Most of the agents were discovered between 1950 and 1970.
To grow exponentially and metastasized, solid tumors require an ever-increasing supply of nutrients carried by the human protein albumin. Tumors have adapted to meet their increasing need for nutrients. Angiogenesis is one such adaptation. By this rapid growth of newly formed dense vasculature, nutrients are carried to the tumor by serum albumin, the most ubiquitous protein in the body. How does
Classification of anti-cancer agents. Cytotoxic drugs, targeted drugs, hormonal drugs. Shortages of anti-cancer agents are even more critical, because there may be no equivalents for the drugs that are in short supply, and conversion factors and dose adjustments may be unknown. Recent media coverage has highlighted shortages of cytarabine, daunorubicin, and methotrexate.
Addresses a very serious item. Oncology today is a serious shortage of drugs, which is clearly affecting medical oncologists all over the country. As you can see from the report, something like 75% of oncologists are directly affected by the drug shortage. And this has led to a number of things that oncologists have had to do just to manage their patients. And that includes things like
Strategies. Prioritizing patients for access to certain drugs. Using equivalent agents, sophists to bridge the gap. Mechlorethamine. The regime with mechlorethamine proved to be effective while allowing for preserved fertility and reduced risk of secondary leukemia as compared with MOPP, and reduced risk of cardiopulmonary dysfunction as compared with other regimes in use. Cyclophosphamide at a dose of 650 mg per square meter of body surface area could safely be substituted for mechlorethamine 6 mg per square meter. Treatment with cyclophosphamide was significantly less effective. 2-year event-free survival, 75% with cyclophosphamide versus 88% with mechlorethamine.
Hello, my name is Dr. Ron Barthet. I'm from the University of Nebraska at Omaha. I would like to discuss my study that is published in the journal, Central Nervous System Agents in Medicinal Chemistry. This study is entitled Mechlorethamine-Based Drug Structures for Intervention of Central Nervous System Tumors. Central nervous system tumors are the third.
Most of the curative treatment regimes are based on chemotherapeutic agents that have been available for decades, but some of these have recently been in short supply. These shortages are likely to have devastating effects on patients with cancer and must be prevented. For many of these agents, no adequate substitute drugs are available.